everyone, I'm Dr. Marina and today I'm going to present you the clinical aspects of headache as well as the classification and treatment of it. But before we start, don't forget to hit the subscribe button on this YouTube channel for more medical videos. First of all, we need to know the fact that not all types of headaches necessarily reveal a serious affection or a life-threatening episode. For correctly diagnosing a primary headache from a secondary one, the latter meaning it is caused or triggered by an underneath pathology, we need to know the red flags, these existing in the secondary type. And one of the red flags mentioned on this slide might be a new headache, maybe even associated with fever. As I briefly mentioned above, we can classify headaches into primary, the subtypes being sinus, tension, migraine, and cluster headache, and secondary headache, caused, for example, by a tumor. Now, moving on specifically onto the classification of headaches, let's view the primary headache subtypes and their features. Migraines are specifically acting in recurrent attacks, being localized unilaterally, having a gradual onset and a crescendo pattern with a moderate to severe intensity. Symptoms may include aura and photophobia, and the treatment should be adapted if mild or severe. In mild migraines, non-steroidal anti-inflammatory drugs can be administered, but if the migraine is severe, triptans should be the drugs of choice. Prophylaxis includes beta blockers, calcium channel blockers, and anticonvulsants. In cluster headache, there is a trigeminal autonomic diaphalgia actually. The pain also being unilateral in the ophthalmic area, and this pain begins quickly and is continuous. Symptoms are autonomic, of course, and in order to properly diagnose this subtype of primary headache, an MRI is needed to rule out any other cause. Treatment includes oxygen administration and triptans as well as in migraines, and for prophylaxis, a calcium channel blocker is the drug of choice. When referring to tension headache, we say regular headache. This one is bilateral, and what is specific for this subtype is the pain that actually feels more like pressure or vice-like pain, meaning it is a front to back neck pressure or tightness. The treatment for this regular type is administration of non-steroidal anti-inflammatory drugs. And last but not least, sinus headache. This one is associated with sinusitis and the treatment needs to be adapted to this cause. We mention here supportive therapy, analgesics, antiemetics, and antibiotics. On the other hand, in secondary headache, we need to focus on the red flags and alarm symptoms, and for this, I got a mnemonic to better remember them, SNOOP. Systemic signs and disorders, neurologic symptoms, onset new or changed in patient over 50 years old, onset in thunderclap presentation, papilledema, pulsatile tinnitus, precipitated by exercise, and so on. In the following slide, there are some causes that lead to secondary headache and the treatments required for them. If headache and associated fever are present, we can suspect bacterial meningitis, and an antibiotic we could administer in this case is ceftriaxone, a third-generation cephalosporin. If in addition the patient has functional neurologic disorder, we can suspect an abscess that, if existent, needs to be drained. If the headache worsens in the morning and with cough or just progressively worsens, we can suspect a tumor that needs to be treated accordingly, for example with radiochemotherapy. If the patient has a severe headache for the first time, or it is a thunderclap headache or the worst headache of their entire life, we should perform a CT scan. And the last two scenarios including also the need of a surgery. Now in this slide, I just want you to pause the video and take a moment to look at these pictures in order to remember the specific localizations of all these subtypes of primary headaches. Thank you for watching and see you next time on MedWay YouTube channel for more medical content.